Hello again, everyone. Hope you have had a good morning so far. Um, Today's topic, we will talk about schizophrenia. Um, it's it's a really scary disease because it's hard to diagnose it. I'll talk more in depth to it. Next slide. So, schizophrenia is a serious mental disease in which people interpret reality abnormally. Schizophrenia may result in some combination of hallucinations, delusions, and extremely disordered thinking and behavior that impairs daily functioning and can be disabling. So the scary thing about it is when you're hallucinating and you don't sense what's going on. You have a loose sense of reality. This is majorly because there's a reduction in your sensors don't work properly, in which you just lose sense of reality and you just imagine weird things. And it's hard to tell when you're hallucinating or not because you can't tell what reality is. So this is what really makes it scary. Next slide. So the symptoms of schizophrenia are delusions, hallucinations, flat affect, bizarre behavior, disorganized thinking, and paucity of speech or thought. It just gets weird. You don't sense things properly. You start thinking weird. You start behaving to your hallucinations and your delusions. So it's scary. This is majorly in children. Next slide. So the symptoms, as we said, hallucinations, which means hearing or seeing things that do not exist outside of the mind. So these things that you're seeing are just in your mind. No one can see them except for you. So when a doctor says, "What are you seeing?" you explain what you're seeing in your mind, but the doctor never sees these things that you have. Delusions or unusual beliefs not based on reality. You start making weird thoughts that don't actually exist. Muddled thoughts based on hallucinations or delusions. Yeah, you start thinking about these hallucinating and you start acting based on these hallucinations or delusions. Losing interest in everyday activities. You just get so overworked by these hallucinations that normal things are not fun anymore. Not caring about your personal hygiene. By personal hygiene, they mean like taking care of your body and make sure that you're clean. Wanting to avoid people, including friends. Schizophrenia does not cause someone to be violent, and people with schizophrenia do not have a split memory. So it's not violent. Like they don't get violent thoughts, but they have weird things inside their mind. Next slide. So these are the types of hallucinations that happen. No one sees this except for you. So you might see just shadows and weird stuff, and you can't control it because it's in your mind. You have a mental disorder. And how can you, like, for example, how can you explain this to a doctor? It's pretty hard to imagine. Make the doctor imagine what you're seeing, or if like the tunnel is rotating or something like that. It's pretty tough. And next slide.
There is no single test for people with schizophrenia. Usually, they use multiple tests to diagnose people with schizophrenia. The sooner the treatment, the better. Schizophrenia is usually diagnosed if you experience one or more of the following symptoms, which are delusions, hallucinations, hearing voices, incoherent speech, or negative symptoms such as flattering of emotions. Your symptoms have had a significant impact on your ability to work, study, or perform daily tasks. Other possible causes such as drugs or bipolar disorder. They do the diagnosis by doing a physical exam. This could give you a prevention from further complications. They also use tests and screening. They will use MRI or CT scans, screening for alcohol and drugs. This will help rule out conditions with similar symptoms. Psychiatric evaluation. Your mental health professional will check mental status by observing appearance and demeanor and asking about thoughts, moods, delusions, hallucinations, substance use, and potential for violence or suicide. This will also include a discussion of family and personal history. Diagnostic criteria for schizophrenia. They will use DSM-5 criteria. In this criteria, the individual must be experiencing 5 or more symptoms during a 2-week period, and at least one of the symptoms should be depressed mood or loss of interest or pleasure. The causes are a combination of physical, genetic, psychological, and environmental factors. Genetics. Different combinations of genes makes people more vulnerable to schizophrenia. Brain development. The structure of the brain in schizophrenia differ from those of normal people. Neurotransmitters. An imbalance between the two main types of transmitters, which are dopamine and serotonin, can cause schizophrenia. And triggers. Stressful life can cause schizophrenia.
Okay, so this is let's say a comparison between a healthy mind control and a mind with schizophrenia. What happens is the sensors and there's a lack of censorship in schizophrenia. So as you can see, there's not too much activity, or the synaptic markers are not too high. And when in the healthy mind, there's a lot of activities. It can sense what's going on. Schizophrenia cannot really sense reality as good as the healthy control. Or is this right, Mr. Natafon? Or do you have anything else to say about this picture? Because I'm not really sure what this exactly means.
Well, a healthy control shows you how much activity there is in your neurotransmitters relaying signals to one another. So the red just means a high concentration of activity, and the green and blue means that it's suppressed. So synaptic marker levels just means how much of a flow you're receiving. Usually when you do brain scans like this, I'm guessing this is a MRI image. It can be an EKG MRI or some sort of positron emission tomography PET scan that measures these types of things. And it just shows concentration levels. So red in these types of studies usually indicate normal functioning, and blue means depressed, ADD, schizophrenia, stuff like that, where there's not a lot of activity between synapses. And a synapse, for those of you that have taken biology, you've probably been introduced to what a synapse is, but it's when the end tail of a neurotransmitter called the dendrites release the vesicles containing the neurotransmitters to the receptor neurons. And that's what a synapse is. So that's what they mean by synaptic markers. Anybody here know what action potential is? No? Okay, then I'll leave that. But that's like at the core of transmission in your neurons, an action potential. It has to do with like sodium, potassium, concentration gradients, all of those things. You can keep going.
Certain factors that can increase the risk of schizophrenia include inherited, having a family history of schizophrenia, pregnancy complications such as malnutrition or exposure to toxins or viruses that may impact brain development, taking mind-altering drugs during teens years and young adulthood. Complications include suicide attempts and thoughts of suicide, anxiety disorders and obsessive compulsive disorder, which we will talk about later, depression, abuse of alcohol or other drugs, including nicotine, inability to work or attend school, financial problems and homelessness, social isolation, health and medical problems, being victimized, and aggressive behavior. محمد النمر.
I heard that many people with schizophrenia, most of them have a symptom of hearing, hearing voices, such as, you're a terrible person and such.
Yeah, I think that's the main symptom of schizophrenia, Ali.
What do you mean? I didn't hear that. Can you guys hear me?
Yeah, yes, we can hear you.
Yes.
Oh, okay. What
Your
were
turn,
you saying,
Mohammed.
Ali?
I said that I think most people with schizophrenia hear voices. That's the main symptom, I think. I'm not sure though.
It has to do
They
with
hear
all the sense. You have
criticism and stuff.
you have
What are you
hearing,
saying?
and so it's like it's not only what you that you see and imagine things. You can also hear things that are just in your mind and not coming from outside. Do I make sense, or am I just saying? Yo, fire. Is it the how to treat schizophrenia? Allah, I don't know how to say this word. Is it the just like most mental diseases, it's usually medication and psychotherapy. We've talked about them enough in the past days, so I don't think we need to go over them again.
Even with the treatment, most of them just live up to 3 years. People diagnosed with schizophrenia. Some may live to up to 10 years, but most of them just 3. So this treatment is not really something that's
do they die because of suicide, or is it natural death?
Oh yeah, that's right. That's right. A lot of them commit suicide. That's true.
Yeah, if they don't, the psychotherapy and medication can help reduce the symptoms in which they don't go to the level of they want to commit suicide. It's really it's hard to treat. It's a chronic disorder. There's no specific treatment. There's no specific solution, but you can reduce and control the symptoms as you go on. It's the same thing with like most mental diseases. Right. Very good. Yeah. Next slide.
Psychological treatment include individual therapy. Psychotherapy may normalize thought patterns. Learning to cope with stress and identify early warning signs of relapse can help people with schizophrenia manage their illness. Also, social skills training. This improves and helps communication and social interactions and allowing you to participate in daily activities. Family therapy. This provides education to families dealing with schizophrenia. And vocational rehabilitation and supported employment. This helps people to not lose their jobs while they are schizophrenic. We're gonna watch a video explaining schizophrenia.
Schizophrenia was first identified more than a century ago, but we still don't know its exact causes. It remains one of the most misunderstood and stigmatized illnesses today. So let's walk through what we do know, from symptoms to causes and treatments. Schizophrenia is considered a syndrome, which means it may encompass a number of related disorders that have similar symptoms but varying causes. Every person with schizophrenia has slightly different symptoms, and the first signs can be easy to miss. Subtle personality changes, irritability, or a gradual encroachment of unusual thoughts. Patients are usually diagnosed after the onset of psychosis, which typically occurs in the late teens or early 20s for men and the late 20s or early 30s for women. A first psychotic episode can feature delusions, hallucinations, and disordered speech and behavior. These are called positive symptoms, meaning they occur in people with schizophrenia but not in the general population. It's a common misperception that people with schizophrenia have multiple personalities, but these symptoms indicate a disruption of thought processes rather than the manifestation of another personality. Schizophrenia also has negative symptoms. These are qualities that are reduced in people with schizophrenia, such as motivation, expression of emotion, or speech. There are cognitive symptoms as well, like difficulty concentrating, remembering information, and making decisions. So what causes the onset of psychosis? There likely isn't one single cause, but a combination of genetic and environmental risk factors that contribute. Schizophrenia has some of the strongest genetic links of any psychiatric illness. Though about 1% of people have schizophrenia, children or siblings of people with schizophrenia are 10 times likelier to develop the disease, and an identical twin of someone with schizophrenia has a 40% chance of being affected. Often, immediate relatives of people with schizophrenia exhibit milder versions of traits associated with the disorder, but not to an extent that requires treatment. Multiple genes almost certainly play a role, but we don't know how many or which ones. Environmental factors like exposure to certain viruses in early infancy might increase the chance that someone will develop schizophrenia, and use of some drugs, including marijuana, may trigger the onset of psychosis in highly susceptible individuals. These factors don't affect everyone the same way. For those with very low genetic risk, no amount of exposure to environmental risk factors will lead them to develop schizophrenia. For those with very high risk, moderate additional risk might tip the balance. The antipsychotic drugs used to treat schizophrenia have helped researchers work backwards to trace signatures of the disorder in the brain. Traditional antipsychotics block dopamine receptors. They can be very effective in reducing positive symptoms, which are linked to an excess of dopamine in particular brain pathways. But the same drugs can make negative symptoms worse, and we've found that negative symptoms of schizophrenia may be tied to too little dopamine in other brain areas. Some people with schizophrenia show a loss of neural tissue, and it's unclear whether this atrophy is a result of the disease itself or drug-induced suppression of signaling. Fortunately, newer generations of antipsychotics aim to address some of these issues by targeting multiple neurotransmitters, like serotonin, in addition to dopamine. It's clear that no one transmitter system is responsible for all symptoms. And because these drugs affect signaling throughout the brain and body, they can have other side effects like weight gain. In spite of these complications, antipsychotics can be very effective, especially when combined with other interventions like cognitive behavioral therapy. Electroconvulsive therapy, though it provides relatively short-lived relief, is also re-emerging as an effective treatment, especially when other options have failed. Early intervention is also extremely important. After months or years of untreated psychosis, certain psychoses can become embedded in someone's personality. And yet, the dehumanizing stigma attached to this diagnosis can prevent people from seeking help. People with schizophrenia are often perceived as dangerous, but are actually much more likely to be the victims of violence than the perpetrators. And proper treatment may help reduce the likelihood of violence associated with schizophrenia. That's why education for patients, their families, and their communities helps erode the stigma and improves access to treatment. Continue to educate yourself about the symptoms, causes,
So, as you heard in the beginning, schizophrenia is a syndrome, not a disease. And the difference is that a disease has a defining cause, while a syndrome is a group of symptoms that might not always have a definite cause. Any questions?
It's also stated in the video that this disease has been known for a long time. I think it said like 2,000 years ago. But the thing is, it's hard to get a lot of information about what's going on inside the person's head. Just because it's a lot of stuff not really, that's non-realistic. So it's hard to see exactly why these things are happening. Although, like, we found people found a lot of information, and continue to develop information about this specific disease. I don't think that there's a possibility to get enough information about this. Any comments or questions? Mr. Natsupon, if you have any comments, you go ahead.
I don't have anything further to add to what that video stated.
Okay, then
Alright.
Yeah.
here's the
But-
end of the presentation. Thank you for your attention.